Hello everybody. So as you can see from the title of this video is about the psychiatry question discussion of recently conducted FMGE Foreign Medical Graduate Exit Exam MCI screening exam held in June 2022. We had 6 questions of psychiatry this time related to psychiatry, and most of them were pretty simple and most of the students were able to answer. But still it's important that we discuss them all so that the future students who are preparing for FMG next time are aware about the topics being asked and can prepare accordingly. So very simple questions, most of you will be able to answer them. Let's give it a try. Continuous rigorous washing of the hands is suggestive of obsessive compulsive disorder. In this particular disorder, the person feels that his hands are dirty, because of which he repeatedly washes his hands. So compulsion, continuous rigorous washing is a compulsion. There are two types of thing in OCD. One is obsession and other is compulsion. I would like to remind you that this is a basic thing. Obsession is a thought and compulsion is a motor act which you do to counter that thought. Example, feeling that my hands are dirty. Dirt contamination is an obsession, and repeated washing of the hands is a compulsion. Feeling that my hands are dirty is an obsession, and repeated washing is a compulsion. So continuous washing is suggestive of OCD. A patient underwent surgery and a mass of hair was found in her stomach. What is this? Trichotillomania, tuft of hairball in the stomach. This happens in patients who have trichotillomania. It's nothing but hair pulling disorder. So if a surgeon operates a patient with abdominal lump and he finds a trichobazor, then probably the patient might be having a trichotillomania, and trichotillomania needs to be referred to a psychiatrist. This is how this question has been framed. So mass of hair, trichobazor, trichotillomania, psychiatrist. Because it's an impulse control disorder, so we have to do habit reversal psychotherapy and SSRI, something like fluoxetine. The disorder characterized by sexual gratification by inflicting pain on the partner is called sadism. Inflicting pain on the partner. Getting inflicted pain from the partner. Some students were saying after the recall that sir, it was getting inflicted pain, then it is masochism. Voyeurism is watching others getting intimate, and fetishism is with non-living objects, deriving sexual pleasure with non-living objects. All of these are types of paraphilias. All of these are types of paraphilias. That's about question number 3. Question number 4. A patient presented to psychiatry OPD. On being asked what's your name, the patient repeated the same question. So repeating examiner's words is called echolalia. Repeating examiner's actions. Suppose I do this in front of the patient and the patient also does this. Both of these are seen in catatonia. Perseveration. It is defined as persistence of same response beyond the point of relevance. Example, I asked my patient, what's your name? And he replied Ram. Suppose Ram was his name. Then I asked him, where are you from? And he again replied, I stay in Ram. Or he just said Ram. Then I asked him, what's your qualification? He said Ram. So here the patient repeats his own answers. First uttered answer is the correct answer, but subsequent answers are not only incorrect, they are same as the first uttered answer. Same as the first uttered answer. Do you understand this? That is called perseveration. And what is posturing? It is maintaining a posture. Again seen in catatonia. Maintaining a sustained abnormal position for a long time. Perseveration is seen in organic mental disorders. Organic means those mental disorders that have a cause. Organic mental disorders. Clear? Next question. A female patient wants to get rid of her tobacco addiction. For tobacco addiction, we have varenicline and we have bupropion. It's an INICET question that varenicline has more efficacy than bupropion. Varenicline is alpha 4 beta 2 nicotine partial agonist, and bupropion is norepinephrine dopamine reuptake inhibitor. Naloxone is, they are both used in opioid. Naltrexone is also used in alcohol and opioid. Answer is varenicline. Sixth and the last question. A pregnant female with bipolar presented for the treatment. Which of the following drugs should be avoided? So in bipolar pregnancy, we have to think about teratogenicity. Teratogenicity wise, the number one is valproate, then is lithium, then is carbamazepine, and then is lamotrigine. So the most teratogenic is valproate, but since valproate was not in the question, we would have marked lithium. Lithium is more teratogenic than lamotrigine. In fact, in pregnancy and lactation, the drug of choice becomes antipsychotics because all the mood stabilizers are teratogenic. The drug of choice for bipolar in pregnancy is antipsychotic. Now some students were of the opinion that this was not the question. There was another version of the question shared that a patient who has a family history of bipolar, now which drug to be avoided. And some students said something like that the patient herself had depression with suicidal ideation. Can we give ECT? Yes, ECT is safe in pregnancy. Depression with suicidal ideation, in fact ECT is the treatment of choice. So there were a little 2-3 versions of question number 6 that have been given to us, and this is the commonest version we have got as a recall. But if you have any other version and you want to ask me that question, you are more than welcome to share your queries at psychequeries@gmail.com. Thank you very much for listening to this video. Wish you all the best for your results. Thank you.